Is that the amendment be agreed to, and I call the member for Riverina.
Thank you, Deputy Speaker. If only the name of this bill were exactly what was going to happen. The National Disability Insurance Scheme Amendment, getting the NDIS back on track, number 1 Bill 2024. Because if there is any piece of legislation coming before this House, if there is any aspect of society that needs to get back on track, it is the NDIS. In my first of so far 5 terms in this place, the Gillard government brought the NDIS to fruition. Difficulty was there was no money attached to it, and when the coalition took over government in 2013, we had a lot of work to do. I supported the NDIS from the outset, and I do remember the former New South Wales Legislative Council member John Della Bosca, who one of his portfolios between 2008 and 2009 in the New South Wales Parliament was as Minister for Health, and he ran the Every Australian Counts campaign, and I do remember it. Red T-shirts, and he went round with this bubble with writing quote bubble with the words "Every Australian Counts" in it, and I was happy to get a picture in one of those shirts with one of those placards, and I can remember at the time getting criticised because we hadn't agreed to every aspect of it. It was something new. It was something being put forward by Labor. But I thought that I needed to do a couple of things. The first of all was to ring Kurrajong in my electorate, Wagga Wagga, which has been providing services for disability services for 6 decades. I rang Kurrajong, I rang Cathy Smith to see what she thought of this approach, and Kurrajong was supportive. I thought, well, if Kurrajong is supportive, then I should be too. And as I say, it was something that was new. It was something that the Labor government was proposing, and it does remain, I believe, a legacy of Julia Gillard, our first female Prime Minister, and I have respect for Prime Minister Gillard for a number of things, not least of which is this. But it is now mired in mess. There are more calls to my office in relation to the NDIS than any other thing. In fact, you could add up every other call to my office and they still wouldn't match the number of calls to my office that come in relation to NDIS. And they are heartbreaking calls. They are fraught with despair calls. And I asked my electorate officer, who deals with most, if not all, of these matters, to give me some cases. And whilst I don't and wouldn't publish the names, they are very pertinent to this debate. A vulnerable man whose change of circumstance was lodged in November 2023. Today, the 11th of April 2024, his claim has still not been finalised, even though he runs out of money today. If he doesn't have support, there is a danger he will die. Another case, a woman with multiple sclerosis, whose change of circumstance was lodged in February 2024. Her plan had run out of money and her support coordinator was paying for the supports. When the plan came through in late March, the plan was worth less than this woman's plan was 2 years ago. A review of a reviewable decision has now been lodged. Another situation, a young 18-year-old man whose mother had to take him to the NDIS office within the Wagga Centrelink to prove he was non-verbal, even though he had been non-verbal for his whole life. A father who put his son's review of plan in November 2023. He was continually told it was being escalated, but nothing would happen until the plan had $1,000 left in it. Now, in early May 2024, the plan is about to run out of money, and Dad has a promotion in his work and will have to tell his boss he can't start because he will have to stay at home to care for his son. Yet another case. A man with MND motor neurone disease. Had lodged a review for assistive technologies in November and December 2023. It wasn't finalised until the end of April 2024. And this is the kicker. This is the departmental wording at the end of a lot of emails in relation to the NDIS that recipients receive. Please accept our apologies for the delay in resolving this matter for your office, and there's a line redacted there, and family, and for any stress that this may have caused. If the participant requires crisis support, the participant or their support should contact their local GP, hospital or mental health crisis team. Alternatively, they can contact Lifeline on 13 11 14. And my electorate officer, who has worked with me, Deputy Speaker, for more than 20 years in various capacities, and she is one of the most diligent people I have ever met. And she's a patient person, she's a caring person, she's an empathetic person. She said to the NDIS, if you dealt with these matters in a timely manner, our constituents would not be getting stressed out. And she feels it. But more than she feels it, because she can go home at the end of the day and concentrate on her family and do other things. But those families, the pain and suffering that they are enduring is ongoing. They don't finish at 5 o'clock and turn the computer off or stop answering the phone. Their enormous grief and stress is 24/7, and it's hard. I hear reports, and I note that other people who are speaking on this bill have also mentioned it, that the NDIS is in fact taking up, like a big sponge, many of the workers who would otherwise be doing other work, perhaps in aged care, perhaps in childcare, and goodness knows we need more and more people in those two sectors. But why would you want to do the heavy lift of a person who can't get out of bed and strain your back when you could be getting paid 3 times as much? You know, a lot of money per hour to take as a carer, as an NDIS carer, somebody to the pitches, or somebody 10-pin bowling, or somebody to the gym, as in many cases, circumstances that have been relayed to my office. And this is such a shame, because the NDIS is taking a lot of people out of other sectors, being a big drain. And there are circumstances in which people are being paid NDIS, which, let me tell you, anecdotally, that they are questionable, and other people who just simply can't get the support. People who have Down syndrome and yet have to prove every year that they have this condition. I mean, it is just so difficult. So I say, if this legislation were to get the NDIS back on track, all well and good, but I doubt it. I doubt it very much. I received a very telling text from a fellow by the name of Mark Peach this morning. Mark once lived in the central western New South Wales town of Forbes. He's now the New South Wales State Director of Physical Disability Australia, and he wrote several texts to me this morning, very concerning. He said, I know people in the Central West already struggle to access reliable disability services, and this bill, as it sits, will leave families worse off and passes the buck to non-existent services. And there's a bit of a rub there, non-existent services. And I know when the NDIS was first starting out, there were, I would call them shysters, out there trying to get part of the action with the NDIS. People who were not like Kurrajong in my electorate, in Wagga Wagga and beyond, who were not people with years of experience, years of care, years of concern, years of compassion, years of professional experience, but they were just coming into the NDIS thinking they could make a fast buck out of people, families who, quite frankly, were being dudded out of what they should have been receiving under this new system. Now, Mr Peach continued, Bill Shorten knows these changes, I mean his words, not mine, I would say the minister, but knows that these changes will make the NDIS more like aged care and will force families to relinquish care of their disabled brothers, sisters, mothers and fathers and force them into homes living with two others with a disability. Like me, no one plans on or wishes to end up with a disability. They're living in a country where we still have the chance to live a meaningful life, have a family, work and have the same opportunities as others is something Aussies have come to be proud of. Studies undertaken by the NDIA as a participant of the review show that the public have a sense of ownership and want to protect the disability community. And he's right, because I know all Australians, all parliamentarians would want the best for those people who are, unfortunately, through no fault of their own, having to call on NDIS services. And Mark continues, the problems we see with the NDIS today are tied to poor administration, inflated and inefficient systems and red tape that would call for an OT to write a $400 report for a $20 item, and fraud that is allowed to occur because the NDIA and Commission use pricing strategies that disregard quality services and encourage cowboys. I call them shysters before, but there are, unfortunately, cowboys in this sector, in this system. More red tape is not the answer, especially for rural communities. We need more common sense and bureaucrats who actually speak and engage with the system they wish to change. And he said, later today we're expecting statements from a number of peak bodies highlighting concerns on the contents of the legislation. That sentence from Mr Peach worries me, because I know that Labor, when they came to office in May 2022, and more's the pity they did, but I know they said that they would... I could take that interjection, Shane, but anyway, we move on. I know he was being facetious, but it was a shame. In fact, it was a shame because we heard that we were going to see more transparency and more probity, but in fact, quite opposite is the case. And Labor should have consulted more widely and broadly for this particular legislation. They will claim they have. I doubt that. The letter from Mr Peach, or the text from Mr Peach, continued that the most problematic is Section 10, which is likely to be shot down by the Human Rights Committee as it cherry-picks only some of the sections of the United Nations Convention on the Rights of People with a Disability. Mr Peach is right. He's got skin in the game. He knows that the NDIS, as it stands, is riddled with problems. It is draining people who would otherwise be engaged in other activities from those activities into this, and it is a whirlpool of money that really needs to be addressed. I can remember the New South Wales Premier Maurice Yemmer, a Labor Premier, talking in the 90s about the fact that the health budget was, if it was left to run as it were, was going to take up almost all of the state budget, and he, as a former minister and then premier, strove to do something about it, and and I pay tribute to him for doing just that. He was, in essence, a good premier. And this is the same. We face a grave dilemma here with the NDIS, that it will, as a money whirlpool, just suck so much out of the budget, and I appreciate that much of it is uncapped, but so much out of the budget. But what we need to do is do a thorough investigation about where the money is being spent, why people who have conditions that are lifelong conditions have to consistently and continually prove that they have those conditions, why there are such delays. I appreciate in the budget we're getting 36,000 more public servants. No doubt most of them will be occupied on shiny seats here in Canberra. They need to be, if we're going to have that many thousand more public servants, they need to be doing gameful sort of activities, and that is perhaps on the NDIS switchboard, and making sure that we address some of these cases, making sure that we go through so that people such as those case examples that I read from my electorate officer aren't happening more and more and more. And we have to listen to people like Mark Peach, who knows what he's talking about, who it's one of the main reasons he had to move from Forbes to Wollongong. It's forcing people with disabilities out of local communities in the cities to access services. This is not fair. This is not equity. This is not right in the Australia that we live in 2024. And the government has to, must and should do better.
I do thank the honourable member for Riverina for his contribution, and the question now before the House